السلام عليكم، يعطيكم العافية. أنا الدكتور ضياء سويدات، أخصائي الطب النووي والعلاج بالنظائر المشعة. اليوم حالتنا Hepatocellular carcinoma and imaged by gallium FAPI PET CT scan. Gallium FAPI is one of the novel tracers in assessing many cancers that are not properly assessed by FDG. Hepatocellular carcinoma is one of the cancers that the FDG has low sensitivity. And what is the cause of the low sensitivity of FDG PET CT scan in detecting the well-differentiated hepatocellular carcinoma? The answer is that there is a overexpression of the phosphatase. The phosphatase enzyme do dephosphorylation. So when the FDG enter inside the cell, it will be trapped inside the cell because of the overexpression of hexokinases and downregulation of the phosphatase. However, in the well-differentiated hepatocellular carcinoma, there is over or upregulation of the phosphatases, and this means that the FDG will not trapped inside the cell and it will go out the cells again, and because of that there is no FDG accumulation inside the cell, and because of that FDG has low sensitivity in well-differentiated hepatocellular carcinoma. However, in cases of poorly differentiated hepatocellular carcinoma, FDG has a good sensitivity. This case is a well-differentiated hepatocellular carcinoma, and as we said, FAPI has a much higher sensitivity in detecting the primary tumor and metastatic sites than FDG. As we see here, this is a MIB image, and this is the distribution of the FAPI. Let's start from the brain. No activity in the brain. The sinuses are normal. No evidence of FAPI-avid cervical lymph nodes. The thyroid gland is normal as well. No evidence of mediastinal lymph nodes, axillary lymph nodes. There are a few axillary lymph nodes with a preserved fatty hilum and non-significant FAPI activity, and these are reactive in nature. Let's go to the lung window to search about pulmonary nodules. This is a small pulmonary nodule. It's a sub-centimetric nodule, and this size is beyond PET resolution, so they might be metastases even if they don't have activity. This is one, and there is another one. This is another one. There are two pulmonary nodules beyond PET resolution. Okay, let's go to the liver. There are multiple large liver masses with necrotic centers. They are multilobulated masses involving the dome of the liver, the segment 5 and segment 8 of the right lobe, and involving most of the liver lobe with heterogeneous FAPI activity and necrotic centers. We should measure the prominent one. The prominent one measuring about 19 by 14 centimeter axially with SUV max around 7. There are no other FAPI-avid liver lesions. However, there are some upper abdominal lymph nodes with mild FAPI avidity, and they are suspicious for metastasis. Peripancreatic, left paraortic, aortocaval, and left paracaval, and portocaval lymph nodes. All of them are suspicious. These have mild FAPI avidity. This SUV max around 2.1 or 2.2, and these are suspicious for regional metastasis. The kidneys are normal. Let's see the peritoneum. No evidence of FAPI-avid peritoneal lesions. These are many presacral and mesorectal lymph nodes. They are concerned. This is a FAPI-avid wall thickening in the rectum. It's very, very concerning. It's FAPI-avid wall thickening in the rectum associated with adjacent intense FAPI-avid regional lymph nodes, perisacral and mesorectal lymph node. This is suspicious for another colorectal or rectal malignancy with adjacent regional lymph node metastasis. The prostate is normal, and the bones are normal. The musculoskeletal system is normal, except for the focal FAPI activity in the left dental region. This is inflammatory in nature. We said before, FAPI has a lot of false positive results due to inflammatory processes in the body, in the dental regions, in the joints, and many other places. And this is our report. This is gallium FAPI. The brain is normal, head and neck are normal. Just there are 2 right pulmonary nodules beyond PET resolution. Regarding the abdomen and pelvis regions, there are large multilobulated liver masses involving the liver segments. These are segments 5 and 8 from the right lobe, as well as most of the left lobe, demonstrating abnormal heterogeneous FAPI avidity with necrotic regions, and this is the largest one, as we said. There are upper abdominal lymph nodes with mild FAPI avidity. These are the lymph nodes: peripancreatic, portocaval, para-aortic, and aortocaval, and paracaval. However, the incidental finding is the rectal wall thickening. The patient sent for assessment and staging for hepatocellular carcinoma. However, incidentally, we found another suspicion, a suspicion of another primary rectal malignancy, the rectal wall thickening with SUV max 5.3. Add multiple FAPI avid regional lymph nodes. These are suspicious. Everything is normal except for the left dental region. It's inflammatory and needs clinical evaluation. And this is our conclusion: FAPI avid malignant, large multilobulated liver masses, in keeping with the non-primary liver malignancy. FAPI avid metastatic, mild. We should add mild FAPI avid metastatic upper abdominal lymph nodes. And this is regarding the incidental finding about rectal wall thickening and the regional lymph nodes. We should mention the pulmonary nodules, even they don't take enough activity because they are beyond PET resolution, so they are in the gray zone and needs follow up. And this is our case for today. Thank you. Assalamu alaikum.